People are still trickling in, but we'll go ahead and get this webinar started. Hello, everyone, and welcome to Effective Business Practices in Workplace Mental Health. My name is Kendra Lucas, and I am a Research Associate for Mental Health America, or MHA, and will be your moderator this afternoon. This webinar is co-presented by MHA, a national mental health advocacy organization, and a National Organization on Disability, or NOD, which seeks to increase employment opportunities for Americans with disabilities. Before we get started, I want to share a few housekeeping items. We encourage you to introduce yourselves in the chat so you can tell us your name and where you're coming from. If you know anything about MHA, we are DC based, but I do have the privilege of working from my home base in Memphis, Tennessee, but would love to know where everybody else is from. This webinar will consist of a presentation, guided Q&A, and audience Q&A. So please type any questions for our speakers using the Q&A Zoom function at the bottom. This webinar is being recorded and will be available to the public within 1 month. We do have ASL interpreters and captions available for anyone who needs accommodations. We do not offer any continuing education units or CEUs, but certificates of attendance will be available upon request after the event. Finally, we will send out a survey after the event, and we would love for you all to submit your feedback. So without further ado, let's meet our speakers. So I'm so excited to introduce our speakers for today's webinar. First, we have Taylor Adams, the Director of Workplace Mental Health at Mental Health America. Taylor spearheads MHA's Bell Seal for Workplace Mental Health National Employer Recognition Program and its annual Mind the Workplace reports. Her previous work was focused on suicide prevention, and she brings this experience to support companies in evaluating and refining policies to support workers in their mental health journeys. Next, we have Jacqueline Davis, who serves as the DEI and Engagement Coordinator at Mental Health Connecticut, or MHC. MHC is a statewide nonprofit organization whose mission is to partner with individuals, families, and communities to create environments that promote long-term health and wellness. Jacqueline is the founder and chair of the Equity, Social Justice, and Anti-Racism Advisory Committee at MHC. Jacqueline also serves as a board member of the Connecticut Gay and Lesbian Chamber of Commerce, or CTGLC, and has also received a Diversity, Equity, and Inclusion in the Workplace certificate from the University of Florida Mumma College of Business. And last but certainly not least, we have Meryl Friedman, who is the Regional Vice President of Inclusive Policy and Advocacy at Elevance Health. Meryl leads inclusive policy and advocacy for Elevance Health, and she works collaboratively with advocates, community leaders, and stakeholders to ensure the interests and preferences of diverse communities inform our health benefits approaches and healthcare programs. In addition, she leads strategic partnerships with national and local organizations to advance access, health equity, and inclusive public policy. And now I'll stop chatting and I'll pass it off to Taylor to kick off our first segment, a presentation on effective mental health workplace practices.
Hey, thank you so much, Kendra. I really appreciate that. And welcome to everyone joining us. Thank you for the folks who told me the chat was not working, but that should, as you see, should be up and running now. But again, welcome. Just an overview of what we hope to cover today. This is the third webinar in a 4-part webinar series co-hosted by MHA and NOD. So today we'll be focusing on sharing effective workplace mental health practices in 3 areas in particular. We'll be focusing on leadership investment, managerial support, and employee empowerment. And I think I'm most excited about having guest speakers from Elevance Health and Mental Health Connecticut kind of walk us through how they put these practices that we'll talk about into action. All right, so first, those of you who joined us for our first webinar back in May, this slide may look familiar to you. We did a bit of a deeper dive into the findings from the Mind the Workplace 2022 report. This report measured the perceptions of over 11,000 US-based workers across 17 different industries over an 11-month period in 2021. And what we found, the findings reflect that workplace mental health efforts require investment, time, intention, and action from all levels of an organization, including leadership, people managers, and employee advocates, which is why we chose those 3 areas to focus on today. But if you were interested in, more in the stats and the findings of the report, you can download it, or we will have the recording of the first webinar available for folks. Okay, so I'm just going to jump into like the meatiest part of the presentation. We have a lot to cover here, but really I'm going to start, with leadership investment in employee mental health and well-being. And I don't take that word lightly when we say investment. Again, it's time, intention, and action. We've outlined 5 activities that we have seen employers in the last several years actions that they've taken to contribute to a mentally healthier workplace culture, mentally healthier workforce. First and foremost, I think one of the most important things is understanding your workforce's needs. Every industry, every size organization, every region, the population makeup of different organizations is really important. Is going to go into informing what a mental health strategy might look like. This is if you ask the right questions, it's a really great way to identify what the primary drivers of stress and burnout might be for your workplace. It's also, a really great way to determine which benefits and support work best for your workforce. An example of that, one of the organizations that MHA works with, they have just a large population of working parents. So a lot of their policies and programs are geared towards helping support those specific needs. And of course, this is going to depend on the size of your organization, but some examples of how you can measure employee well-being could be a survey, it could be listening sessions, it could be one-on-one meetings. MHA has about 40 employees, so we're a small organization. And one of the things that we've done is conducted what we called stay interviews, comparing it to exit interviews, where we wanted to just understand what kept people happy, what kept them, continuing to work for us. So it doesn't have to be something super structured like a survey, especially since there's been a lot of fatigue with survey over the course of the pandemic. But I think it definitely should be something that's a higher priority to think about employee mental health and well-being. The next part of this is around crafting an employee-centric strategy. So, if you're kind of in this stage in your workplace mental health efforts where you're coming up with a more, fleshed out strategy for this, I think it's definitely important to incorporate employee feedback as part of that. I really love the Employer Assistant and Resource Network on Disability approach to this, where they talk about the 4 A's, which refers to awareness, accommodations, assistance, and access. I think this is a really great way as you're thinking through this strategy to focus on those 4 areas and how you can, create this strategy. So when it comes to awareness, it seems to be the place that most employers turn to when they first kind of dive into, what they want to do for workplace mental health. Mental health is still a highly stigmatized, concept and idea in workplaces, especially since there are stricter boundaries when it comes to like personal and professional matters. But we definitely, over the course of the pandemic, saw that people were talking more and more about this, and especially younger generations entering the workforce, there's a lot less stigma associated, and there's almost like expectations coming into a workplace that mental health is a part of that culture. So awareness campaigns and educating employees about mental health is important, but I do think you need to see it as just one part of a larger strategy. And then when we're talking about accommodations, that's usually associated with physical disability and asking for reasonable accommodations in the workplace. But this also applies to mental health disability in the workplace. So, how do we just educate employees that that's an option for them? How do we, think about that process? And is it comfortable for employees to come forward and disclose having a mental health condition and asking for accommodations? So some of the questions to work through there. So the next A, assistance, just, any type of supports for employees, including an employee assistance program, EAP, any other, I like to call it resources that consider social determinants of health. So like this could be anything from assisting with public transportation costs or with family building needs. But again, something to look into in terms of assistance. And then finally, access. Essentially reducing any barriers that might exist for employees to access employer-sponsored benefits or programs. So offering healthcare that covers mental health and substance use services at parity with physical health services, and that sort of thing. Next piece is around investing resources, and I will admit all of this I am going through it very quickly and not diving into it into a lot of detail. But I recognize a lot of these things are also easier said than done, which is why I'm excited for the conversation coming up. When it comes to investing resources, I think it's super common for a lot of the organizations that we work with often tell us, we don't have a huge budget to work with this. We're still kind of building our case to leadership on why this is important and why we should focus on this. We're really good at being resourceful and finding a lot of meaningful, trainings and education with limited funds. And that's absolutely doable, especially for smaller organizations that don't have as much to dedicate to that. But I think another great way that leadership can invest in this space, aside from budget, is also in personnel and staff time. Something that we've seen increase a lot more over the last several years is having a designated salaried position for this, having a wellness coordinator, having someone who focuses on employee health and mental health. Also, a lot of individuals will establish an employee, a mental health employee resource group. In which case, I think it's, one way for leadership to show their support is to allocate time to those activities that the group conducts. So at the end, it's all for the betterment of the workplace culture and trying to educate employees, but not be an increased burden on folks who volunteer their time to be a part of those groups. The next piece of this is communicate and educate often. I think this is the activity that we saw the most of during the pandemic or during the height of it. And it's something that we talked about a lot when it comes to communicating that mental health and well-being is a priority. Often, ramp up those communications. I think organizations did a really good job of that, but without addressing these other or doing these other activities, it could, there's the potential that it could fall flat. So, it's great to communicate one thing, but going back to that investment of time, intention, action, ensure that you're incorporating the evaluating employee mental health, thinking about a larger strategy. And I wanted to note that it's good to consider the communication methods for different functions and different work environments. For example, if you're an employer that has a corporate headquarters and then distribution centers and also, retail sites, how people receive information is going to be different. So emails and newsletters versus posters or, printable postcards that can be shared and things like that. And then the final piece of this, modeling expectations. So I have two perspectives when it comes to this. One is, as a leader, and when I say leadership, this includes, board, executive leadership, human resources, your people managers, anyone who is a decision maker within an organization and has that influence. Kind of falls under this umbrella. But model expectations just by speaking openly and honestly about personal, mental health concerns as a leader. It's a very vulnerable position, but it speaks volumes to talk about, the things that make you human as well and that people really resonate with. But then the other side of modeling expectations is ensuring you're taking care of yourself. There is a ton of pressure on leaders to, not only lead, but kind of make these decisions. And this is a lot to ask of anybody to kind of pull together. But ensuring that you're practicing that healthy life-work blend behaviors and setting that expectation for the organization. So next piece to focus on here will be around developing supportive people managers. I personally absolutely love talking about this topic. If there was one thing that employers ask, where should we focus our time? We don't have a large budget. We don't have a lot of time to really invest in this. Where can we start? And this would be it for me. It'd be focusing in on your people managers and what they can do to help support that mentally healthy workplace culture. Year after year of research shows a consistent and strong relationship between managerial styles and employee stress and well-being. Employees who do not feel supported by their direct manager experience increased stress, feelings of isolation, and job dissatisfaction. Also, there's higher rates of absenteeism and increased mental health concerns. So all of this could be directly tied and correlated with the relationship that employees have with their managers. And also I do want to mention this, the same goes for peers and your team members on your team. And we're focusing on kind of the manager aspect today. But two things here, I wanted to emphasize: encouraging fair and effective management practices. There is a long list of things that you can do, but I just included a couple examples here. But having regular check-ins is super, super important with direct reports, as well as having open door, flexible work policies, being accessible as a manager, having clear and realistic expectations about workload and delegating that, and even providing emotional support as a recommended practice. And that could be as simple as asking an employee how they're doing before asking how their project's going, for example. And then the second part of this, it was intentional to say provide management training and not provide mental health management training. I'm a really big believer, well, and also it's supported by the research as well, but I'm a believer that no manager is expected to be a mental health professional. And I don't think it's necessary to know all the signs and symptoms of mental health conditions to be an effective and caring, empathetic manager. Some of the topics that we recommend when someone asks, well, what type of training should we seek out? It's often things around emotional intelligence and its application to the workplace. So how to be an emotionally intelligent manager, how you interact with different people within your team, how you interact with leadership, is going to do a lot more for you than maybe necessarily understanding all the signs and symptoms of a mental health condition. Also, though, it is important if you have staff that you manage, maybe noticing signs of acute stress or burnout in the folks that you manage, and that can kind of manifest itself in different ways. So just knowing your staff a little bit more personally, and just knowing what the signs are to look for. And it's I don't know if it's surprising, but the signs and symptoms of chronic stress, burnout, depression are eerily similar. But there isn't that expectation to know the difference. Just know when is the right time to step in and provide support. And then, I think a really underrated training is around educating managers on procedures when it comes to disclosing a mental health condition, requesting an accommodation. These things are often very confusing and complicated, and it's not the most inviting process if people really do need this type of support. And people managers are that bridge between workers and leadership and HR and things like that. All right, last slide, and then I'll turn it over to the rest of our team here. But the last part was around employee empowerment. Again, just like the having good relationships with your working relationships with your manager, with your team, having investment from leadership, having empowered employees is such an incredible force within a workplace when you're trying to promote positive employee mental health, keep people engaged and excited. Some of the things that we've seen work really well for companies is exploring how flexibility works for your organization. It's different for everyone. Not all job functions, not all organizations can function that way, obviously, but looking for opportunities where there could be flexible work arrangements, staggered work schedules. One organization, they had monthly PTO, a couple hours set aside to encourage well-being behaviors. So if you needed to attend a therapy session, but the available time was at 11 a.m., is there a way to work around that so you can attend therapy or take that time off? Another way of doing this, so promoting employee autonomy, but still providing guidance. And what I mean by that is just some examples, reducing those micromanagement tendencies. I did see a lot of this when we first kind of entered into the pandemic, where people didn't have the same kind of close contact with their direct reports, or as they typically would, and they're like, oh no, what if they're doing this or they're doing this? And it really was like an experiment in seeing how people kind of responded to having that type of autonomy, and how it affected our productivity at work. I think it's a great practice to focus more on the impact or outcomes versus the outputs that employee puts into a project, and being attentive to how much guidance an employee needs. Some people are very self-motivated, self-driven, don't need a whole lot of guidance. It's still always a good practice to check in. And some do need a little bit more, not hand-holding, but want a little bit more guidance and support in certain areas, and just being thoughtful about what works best for each employee. The next point is around allowing employees to have input on decisions, is a really big thing. Some examples of that include providing feedback, and really just providing the opportunity for employees to give feedback to their manager. This is how, for example, this is how I function. This is what I need from you to do my best job. Is this something you can support me with? I do a really good job on project management, but I could use a little bit more emotional support. I could use a little bit more validation. Having those types of conversations with your manager. Another part is, again, not applicable to every workplace by any means, but negotiating aspects of a position. This could be anywhere from, title, positions, workload. I really appreciate the perspective that one organization that I work with, they see it as a job ad versus a job fit. So when they're seeking and trying to get trying to recruit new people into positions, what is this person bringing to the table? It's like, we are happy to kind of accommodate those things, because we see this as something adding to our company, as opposed to trying to fit them into the mold of the position. And then the final piece of that, providing feedback to leadership to improve culture. So again, being the bridge between how do we improve culture, how can employees advocate for that in their workplace. Some examples of that: encouraging employees to participate or lead the conversation workplace mental health by joining a mental health employee resource group, establishing one if one doesn't exist, serving as a wellness ambassador, a mental health champion. And the functions that I've seen of these different roles have been anywhere from just serving as like a peer, as people who are coming into the organization who are new, or from coaching and like professional like growth and coaching, or helping employees navigate things like benefits and understand the process of using the employee assistance program and things like that. And then finally, encouraging employees to become mentors or coaches to support other employees, which kind of follows with those other points there. All right. So jam-packed a lot in there. So I'm going to turn it back to Kendra, who's going to moderate our discussion with our guest speakers.
Thank you for that stellar presentation, Taylor. So now we'll move on to our Q&A segments. And I have a few questions that I'm going to pose to Jacqueline and Meryl, and then we'll take a couple questions from our audience. So to start, and this is to Jacqueline and Meryl, how does your organization move beyond awareness and invest in addressing employee mental health? And either one can start.
I'll start if that's all right. Well, as you heard from the introduction, or seen from the introduction, we are a mental health organization. We are an affiliate with Mental Health America. We have the same exact founder, Clifford W. Beers, who started here in Connecticut, founded our organization out of his own basement, and then went on the next year to found Mental Health America. We are ingrained, like mental health is just ingrained in everything that we do. the staff that come to work for us, they all have a passion and a commitment to this work and to create stigma-free zones for themselves and for those that we serve and for our fellow coworkers, of course. So it's not a hard ask for anyone. We're on the same page. So it's not just about awareness for us. It is everyone investing collectively to make sure that our employees' mental health and those that we serve is always top of mind. Some of the things that we do here to support our staff, I am personally am part of the human resource team. I just joined about a year ago. I've been with MHC for over 7 years. So I've seen the agency from a few different departments and a few different sides, but I've continued to see that growth and that continued investment in our mental health for our employees. So we've created self-care toolkits for our staff. I'm part of our new hire orientation onboarding process, where I talk about what our culture is like, the supports that we have, the opportunities for engagement and feedback, let people know what our values are, and just have this nice, warm, inclusive welcome so that everyone knows from day one, this is what is important to us here at the agency. This is how we're going to support you. And again, from day one, let them know we want your feedback. How can we make sure that you feel welcome and part of this community, part of this family, and just make sure everyone feels that they have that safe and welcoming environment.
The mute button gets me every time. That was terrific. I love doing these conversations and going second because I feel like I can go ditto. Wonderful, except for a few things because I'm not in human resources. But hello, great conversation. Thanks so many of you for joining us. For a brief description, my pronouns are she, her. I'm a white woman with gray curly shoulder length hair. I'm wearing a black shirt and sitting in front of the window in my office in DC, where there's actually a little bit of sun behind me that you might notice, which is quite exciting for a change, it feels like. But Elevance Health is a healthcare company, right? So we work really hard to improve the health of people and communities we serve. And this is just, mental health is so important. It's a part of who we are. And so we work to stick to it and continually talk about the mental health benefits we have available to our associates. We share that directly with associates. We share it with leaders. We encourage people. We talk about it a lot, and we really encourage people to use those benefits, use their time off. I am much better at talking about and encouraging people to use time off than taking time off. And that is not right, right? It's not even right as a leader, but really working to help people see that that time off is really important, and it does help us balance things a little better. And then we also like to bring along some cool solutions. And as a health benefits, a healthcare organization, that's part of who we are as well. And so we recently launched, like 2 years ago, a year and a half ago, I am bad with pandemic time. But we did launch our associate care service, which is really just dedicated to that. Servicing and caring for, the people who work here, my colleagues, and providing support and resources that address loneliness, grief, depression, interpersonal violence, recovery, because and typicalizing, I'll talk a lot about that every time I get the mic today, of typicalizing the discussion around mental health disabilities. And I think we've gotten so much better at it, but we still have a lot of work to do. I will also say happy ADA 32. Yesterday was the 32nd anniversary of the Americans with Disabilities Act. So having conversations around mental health disabilities is part of, sort of our everyday, every month. But specifically this month, we have an opportunity to really launch and build those conversations. We also launched something called Diana Care, which is an organization that we work with, and it's around caregiver supports. Families are juggling a lot. And so really doing some long distance caregiving support. We've got, people who are called the sandwich generation, but I think we're all looking for a little support in different ways. And so it's offering an array of services because everybody needs a little bit of support differently. And so one solution never really covers the territory. So we like to have a really, robust sort of diverse array and variety of resources that people can tap into as they need them, and continue to build that, and talking a lot about self-care. and encouraging people to talk about self-care and actually take action for self-care. And we've done campaigns where we've had people take photos of themselves doing things maybe on a break during the day. Some people will go and pull a few weeds. Some people will take a walk. Some people will walk their dog, right? Anything that says, you know, we can work all day long, but we're also going to take care of ourselves throughout that and really prioritize our mental health through that process, and make sure that we are talking about extending emergency leave and online tools, you know, anything, all the resources around supporting people to manage stress and anxiety and chronic pain. We've got Papa on Demand, which is a service that provides up to 10 hours of time that people can use for on-demand assistance and services that they need. Our associates, right? If it's companionship or light housework, short distance of travel support, a social connection to, you know, reacquaint with your community, pregnancy support. So it's really looking beyond some very traditional approaches that we may have been in, you know, many moons ago, and trying to launch into the next generation of how people access the support that they need.
Thank you, Meryl. Thank you, Jacqueline, for those thorough answers. Moving on to talk a little bit more about that investment. How do your mental health, diversity, equity, and inclusion efforts intersect within your organization?
Mara, would you like to continue to go second, or would you like to take this one?
Probably good that we just keep bouncing back and forth. It's
Okay.
good, and it makes sure that I quit talking.
No, I love everything that you're saying. I'm like nodding my head as you go. This is fantastic. So the intersection of mental health and DEI is my wheelhouse personally. I'm the DEI and engagement coordinator working at a mental health organization. So my role is literally that, finding that intersection and bringing that together. We're starting to use a phrase here. Instead of just saying DEI, we see DEIW, W standing for wellness. I believe that phrase was coined by some grad students at the University of California. It's not ours, but it's one that we're taking on and borrowing and using because it is so important. You really can't separate those things. When you talk about diversity and equity, especially, we all know the last few years in particular have been really rough. We're in a pandemic. We've got social unrest. Police brutality is not going away. Our civil rights are being attacked. This is a very, very stressful time, and it's impacting our mental health on a daily basis. And we can't just continue to live in these vacuums and these bubbles to keep things out of the workplace because we can't talk about that at work. I think a lot of us have all realized, I mean, the average American spends 60% of their waking hours at work. That's most of our life. We need to be able to make our workplaces a safe space and talk about these things so that we're not carrying this burden. And it does affect your work. It does affect your productivity. It affects you being present in the workplace. I don't know how many times I've gotten distracted because my phone's going off with breaking news. I might need to take a step back, take a little break, do some weeding. Like Meryl says, I love to garden. That would be perfect for me, just to kind of process and then be able to get back to work. And I know here at MHC, it is a safe space for people to take those moments and have those conversations. We actually have our chief experience officer, especially since COVID, she started to do virtual processing sessions for staff where we can just dial in on Microsoft Teams, have a video chat, and just say, you know what, today's really hard. And our chief experience officer is a licensed therapist, and she can provide her expert services and guidance and resources for our staff. And it's just the safe community where we can just talk about it. And if someone is not interested in that group session, she is also offered to do those one-on-ones. We have an EAP program. You can have 6 free sessions and talk to anyone that you might want for your mental health care. I know I'm kind of backing up to the earlier question here, but as I said, all these things are really, really connected. And I think that society has just really come such a long way for allowing these things to happen in the workplace, where it's making it more typical. I'm going to kind of borrow off of Meryl here. I like the way that you phrase that. I don't like saying normalizing. It's like, no, typical. I really like that. I'm going to borrow that. So yeah, I think that you just can't separate those things. And if I'm doing my job right, I'm going to continue to push that forward.
I think we just need to team up. This is wonderful. And so I just think when we look at, I love that W. Some people have added a B, right? Diversity, equity, inclusion, and belonging. But diversity, equity, inclusion, and wellness and well-being, they're all important, which is why our acronyms, just get so long. And but I think they're important. I think it's important. I think that we have to take the terminology, the words, the acronyms, right, the letters, and kind of get below those buzzwords like you're doing, right? Breaking it down and making it real. And we do that by typicalizing the conversations. We do, a similar activity here across our business resource groups. So we transitioned from associate resource groups to business resource groups. So our associates were very directly, contributing to the business as well. And it was that really great tie-in. And so we've done that. We've done listening and leading sessions, right? Where we open the phone line and we invite people to come talk about what's going on, around the murder of George Floyd, or around lots of political stuff, right? And we keep it apolitical in a lot of ways, but people are experiencing a lot of fear, what's going on, to impact the lives of, people who identify as LGBTQIA+. Right? We have to bring all that into it. We also talk about intersectionality, right? We're not just like these singular, I just say because I'm very professional, right? So we're a mishmash of things. That's the term. We have a lot of, identities and, identities that are often, oppressed or historically marginalized. And we come with all of that. We come with lots of experiences. It makes us valuable to the company, but we need safe spaces to talk about them, and managers, right, who can learn to open up those difficult conversations and give people safe space. And if they're not, find a way to, right? I think because if you're not comfortable with, that's okay, because it may not go well, but open yourself up to training. We do mandatory training. We do a lot of training around implicit bias and inclusion. I lead a training program for a division, of our organization. And we talk a lot about inclusion and diversity and equity and well-being and belonging, and how to, navigate, associates. And I think the good thing also in many of the organizations, right, that Jacqueline and all of us are talking about today, right, we're also supporting people with mental health disabilities. We're supporting people with chronic health conditions. We're supporting people who are listening to the news and feeling way overwhelmed. We're supporting people who have big full plates at work and family life too. And so it's a matter of balancing. The better we are at supporting each other and building that conversation and typicalizing it in a workplace, really the better we are at doing what we're all committed to doing, which is improving the lives of people and communities. And so I think it really is important, that we come to that. And so we build all that in. We build that in. I'd say, sometimes I just bring my team together, like a weird news alert will come across, right? And I lead our inclusive policy and advocacy team. And so we are a diverse team ourselves. And sometimes we'll get a weird news alert or something big and scary happens to the real world, and I just throw a huddle on the calendar. And sometimes we just stare at each other. We don't say a whole lot. And sometimes we'll talk about how we're feeling, but we create that space. People have to use it the way they're comfortable using it. And the more people can do that in small, medium, and large groups, the more we grow.
Thank you, Meryl. Thank you, Jacqueline, for that. We have about 10 or 12 minutes left for our guided Q&A. So I want to make y'all aware so that, y'all don't get long-winded. So we have time for audience questions. Our next question, how does your organization develop supportive people managers?
Thank you for the time check. I could talk about this all day, so I'll try to keep it brief because I do want to respect the audience and make sure that they can get their questions answered. We talk about supportive people managers, people supporters in general. At MHC, it's not just about focused training for those management, those leaders. Anyone can be a leader in any aspect. So we really take this larger approach that it's not just management, it's for everybody. Support is one of our 5 core values at MHC. We take it extremely seriously. It's literally what we do for our program participants, is to support them so that they can have what they need to gain their independence and to be well and to heal. So we can take that same person-centered care philosophy for our participants and utilize that with our staff and our coworkers from peer to peer. If you do supervisor and down, it doesn't matter. We are all people. We all need support no matter what role we're in. But we do want to recognize the people that are in that leadership position, that they are taking on a whole team as well. And so they need support in that role, but they need to also know how to be supportive of their team. So one thing that we did recently, I actually did a presentation on intersectional allyship and what that looks like, specifically in the lens for our leaders. This was something that our staff had come to me in my role to say, do you have resources on this? So I took a few months, did my research, put it together, and we have monthly offerings to our staff, one of which is called our Equity, Social Justice, and Anti-Racism Advisory Committee Learning Collaborative. I know it's a giant mouthful. We call it the ESJA for short. And so it's an hour long where staff can tune in. It's virtual. So they tune in via Zoom. They see a half an hour presentation on the topic at hand, and then it's an open discussion for another half an hour. So people can ask questions, get clarity, just really dive in, share their personal stories. We practice cultural humility as a team all the time. And this is a perfect venue. And I know, Meryl, you talked about those safe spaces. This is our monthly safe space. It's completely voluntary, and we can talk about those things. So the intersectional allyship presentation really got at how can I be of support in a new lens, to think about how can I be an ally? How can I be a co-conspirator? If I am really good at providing the resources, or am I really good at stepping back and elevating somebody else so that their ideas can be heard? There's lots of different ways to be an ally. So we really got into the weeds of what that looks like so that we can be really supportive for our staff.
I love it. I'm getting ready to do an allyship session in August. And I think it's really important. I think there's no better time to step up and be an ally. There's no bad time. Start now.
Yes.
But I think, and I'll make it quick because I did hear you. We have really strong culture approach, right? We have 100,000 associates. It takes time, but clear culture goals, right? Break it down, ladder up, right? We have to build up. We can't just say, we're going to be inclusive, right? We're going to train you on implicit bias and you're all going to be allies. It doesn't work like that. So we had to create really strong culture goals. The company invested a lot. Leaders are actually leading those culture goals, those culture conversations. It's really important to build that, and it takes time. And for those of us who are a little less patient, I do self-identify with ADHD. So my patience is, sometimes kind of like, let's do it now. But we have to take the time and we have to build. And sometimes we have to go back a little and we have to go forward, but we need to give people the space to learn and to really embrace what that culture is that we all want to work within. So we provide coaching, we provide mentoring. We talk openly about actually living the values. You can't just talk about the stuff. You have to demonstrate what you're actually doing and asking for help. We've all had to ask for help as leaders at various times. And we've just had to do that. And we do that. And we are, colleagues are having, experiences that they're having difficulty navigating, we step in and we help out. So it all really starts to come together, and it has taken time and it is continuing to take time. It's an evolution. But that's where we kind of go with it. And so the more supportive managers are, the more we talk about things. I'm not going to repeat because I know we're short on time. And it's really, I will tell you this, I took we have a wellness screening and I took it this weekend and just to see what it was about. And as I was going through it, and one of the questions was, have you experienced, depressive symptoms or depression for, a 2-week period of time or longer? And I'm like, holy moly, we're in a pandemic, right? People are being murdered. We have problems. People can't, are having trouble feeding their families. We have economic and financial and healthcare issues. I'm like, yes, 2 weeks, probably 3, 4, 5, right? And that's okay, because we're doing all of this work. And then being able to talk about that with other people and finding that balance. Like, how do you talk about your experiences as a leader without making other people feel uncomfortable, nor pressing other people to talk about them, but they can keep it in their minds that you're open to it.
Thank you. Thank you. Okay. We got 2 more questions. Our next one is, how does your organization empower employees either within their positions or as mental health advocates?
For empowerment, I think it really goes back to what Taylor was saying in her presentation. It's about that feedback. It's about that communication, making sure that staff know that they can come to you. We practice an open door policy. We don't just say it, we encourage people profusely, please provide your feedback from day one. We want your feedback day 2, day 20, day 11,000. We continue to want feedback because we have to create culture together collectively. You can't just tell somebody, these are your values. We have to make sure that they actually do reflect all of our staff. It is very, very important. So I think the fact that staff know that they are invited to the table, that they can share their opinions and their insight, good, bad, or indifferent. We want all of it. And that is how we can enact change. I think that in itself is extremely empowering to staff. I know it was extremely empowering to me because if I did not have that comfort and that support from my leadership, and I see my prior supervisor, Susie Craig, is in the chat giving me some kudos. Thank you, Susie, and Braden too. Oh, hi. But if it wasn't for that support that I had, I would never be in the role I am now. The ESJA committee would not have been created. All of these wonderful things would not have happened because if I did not have that support and know that I could provide that feedback, I would have just stayed in my bubble like I did in other jobs. So it's really important to have that communication and open communication to empower your staff.
I totally agree. And I'll also add that they probably come with the power. We have to create space for them to use it and give the tools, right? And so we keep in touch with our associates. We listen to what they have to say. People can share ideas, opinions, whether it be on our intranet. We've got surveys, we've got direct line to leadership. We have through our, business resource groups, through our small teams, bigger teams, and do that. So it's keeping that really open communication, staying in touch. What's important to people. We've done, surveys where we've asked, questions. We've asked people to, share their experiences, and those that are comfortable doing it, we'll do that. And we kind of take it from there. Again, our associates, because we're a healthcare company, are advocating, right, for many other people's mental health. And so it brings that human reaction and experience to what we ourselves and our families and our colleagues are experiencing. And then we start to loop that together and bring it to work because it comes with us. We don't separate from it as much as we try. Right. And then we add all the other trainings. And then I'll just quickly add, so much that is important is the language that we use, being able to identify triggers, being able to speak inclusively, being able to be open to maybe being corrected by how somebody is taking, what you're saying, and being okay with that so that you can actually next time, right, speak more inclusively and not use words that are offensive or triggering to people.
All right, thanks. And last one, very quickly, what program or project are you working on that you're excited about?
Oh, I'm excited about so much right now, but I've tried to narrow it down to one, and that is what's called the MHC Collaborative. This is a new program for us at MHC, and it is specifically for employers and employees, for workforces in general. So we are going out into the community and offering our services for doing one-on-one customized analysis and recommendations for organizations that want to make an investment in their mental health for themselves and for their employees. Again, 60% of your waking hours are spent at work. We know that we have to do the work here. We are doing the work at Mental Health Connecticut. We are actually a recipient of the Bell Seal through Mental Health America. We are taking that expertise and that knowledge, our 114 years as a mental health organization, and giving it back out to the community. So if there's any employers out there that they are inspired by what we're talking about, we can have those customized conversations to say, this is what you need based off of doing a thorough analysis. What are your procedures? What are your policies? What are your dynamics? What are your demographics? Have little surveys and one-on-one conversations with employees from different levels, collect all that information and really find out where you are as an organization, where you want to go. And then we fill in the blanks on the steps of how you get there. So that those organizations can then go, I'll give a plug, to MHA and get their own Bell Seal once they've put in the work in that investment. So it's an extremely exciting program that we have. It's something that I started to work on with some of our staff and our team, and I'm just glad to see it finally coming to fruition. So yeah, that's what I'm super excited about.
Congratulations. Very exciting.
Thank you.
I, like you, could not pick anything. And then like one of the things I really want to talk about, I can't talk about yet, but we couldn't move the webinar a month just so I could get there. So I think I'm going to do two super fast. Like one is just this really strong focus on closing gaps and creating better access for people experiencing mental health disabilities in rural communities. Right. And I think we've just seen a really, a gap and just huge disparate, lots of barriers in accessing equitable, healthcare in rural communities, specifically mental health care. So the digital divide, all the things that kind of make up, right, what those barriers are. Yes, suicide so much, opioid use disorder. So that is really exciting to me. And then one other thing is there's just a really strong focus working with MHA as well on young people, right? And really trying to get in there and get into schools. We are working with a mental wellness basics course of, rolling out curriculum in middle and high schools, right? So that students can really start to learn about, their mental health, their well-being, identify signs, support their peers. And so I think that's really exciting. I think, we're going to be in a position where we can help young people like chart their and manage their trajectory around their mental health, but their overall health and well-being. And when we start young and we're aware and we're attuned and we can start to embrace that, our strongest advocates are on the horizon. And we want them to feel well and have access to supports.
Thank you, Jacqueline. Thank you, Meryl, for participating in this guided Q&A. Now
Thank
we'll
you.
take a question or two from the audience. And by popular demand, Jacqueline, this is for you. What's included in that self-care toolkit you mentioned? And is there any way people can access it?
I did see that in the chat. Thank you for bringing that question up. I'm happy to share a version of it. What we created is very customized to our staff. So there are some internal resources. So I can't share the entire thing, but I'm happy to share a version. I can share that with MHA. Perhaps they can send it with the slide deck for participants. I'll talk to Taylor, but otherwise people can contact me directly, jdavis@mhcon.org. That's mhconn.org. I'll put that in the chat in just a minute. But basically the self-care toolkit starts off with supports that, and this is completely customized for you. So you fill out a form, say who are my support? What is my support team? What do they look like? So you write down your contacts. So if you're in a position and you have your piece of paper with you, and like I'm having a day, you just hand that piece of paper over to someone you trust. They'll contact your support person and make sure you get what you need. Further into the document, you have some grounding exercises. You have access to recorded webinars and workshops, things that we've done internally and other things we've seen externally that really get at what you might need to take those breaks. Again, speaking to what Mara was saying about taking the break to go out and weeding and just clear your head, it has ideas like that in there too. So we encourage people their very first week of being onboarded with us to look through that toolkit and start picking and choosing which ones seem good. So when you're in that good, happy space, you're having a great day, you identify the good ones. So if you're not having such a great day, you can go through and say, okay, let me try number 3 and see if that works for me today, whether it's breathing in for 7 seconds, exhaling for 11, and just taking a moment. Just as simple as that. And it's, I don't know how many, I think I did over 100 different exercises that are in there because as we all discussed today, it's very specific for the person. There's no universal Band-Aid that's going to be self-care for everyone. Everyone has their own things. So that's basically what the toolkit is in essence, and I'm happy to share that.
Thank you, Jacqueline. I think we have time for one more. We have a couple minutes. Meryl, I'll ask you this. Do you have any advice for how to integrate mental health for employees into a large company's culture, especially when that culture hasn't been there before?
Sure, and I consider 100,000 associates here at Advanced Health a large company. I would suggest starting small. Working with your immediate network, bringing in, if you have a chief diversity officer, if you have a benefits officer, an HR officer, a lead, right, that will get involved and help to promote, because then you can build some trainings. And then when you build the trainings, you're actually then see if you can make them maybe mandatory, just one or two. I know we can't have a zillion mandatory trainings. We're all very regulated, but and then you start to build those culture conversations. And then you have leaders who start to talk about mental health, right? And then we talk about just culture and inclusion, and our mental health and people with mental health are part of our culture, right? We're the people, right, who work here. And so I think it's incremental. For us, I have to say, I think the company, and I'm grateful, was always listening and receptive, but gosh, the pandemic really brought, the conversation around mental health, also around, racism and ableism and lots of other things, but to the forefront. But it brought the conversation around mental health. We were asking people, we didn't even realize it, right? We're asking people, how are you? And people would honestly say, I'm struggling. This is scary, right? This is scary. And then we started to say, we're talking about mental health, and people are right. And then you start to connect the dots and you start to build that conversation. Bring people in, see if you can bring a guest speaker in, bring somebody from MHA in, so I think there are opportunities like that. And we'll all pack our patience, because we're going to get to a better place. This conversation needs to stay open. So I'm happy to talk with anybody on the webinar too. I'll put my address in the chat as well. But thank you for the question.
Thank you, Jacqueline and Muriel, again for participating in this guided Q&A and audience Q&A. So just to wrap us all up, I want to thank everyone for joining us today, and our speakers, Taylor, Jacqueline, and Muriel, for bringing their perspectives to this conversation. This webinar is part 3 of a 4-part webinar series. The first 2 webinars were recorded and will be available shortly. You can also join us on August 11th for our final webinar, Workplace Mental Health Employer Perspective. You will find the contact information for both MHA and NOD on this slide. I encourage you to learn more about MHA's Bill Seal for Workplace Mental Health, a national employer certification program that recognizes workplaces committed to employee mental health, at www.mhanational.org/bestemployers. In addition, you can check out NOD's Disability Employment Tracker, a free benchmarking tool that allows companies to measure their progress in disability inclusion against more than 200 participating companies. Once again, these resources will be sent out to you all after the webinar. If you have any questions, feel free to reach out to us. And we hope you found this information valuable and that you enjoy the rest of your day. Thank you so much.